The Delta State government, through the Delta State Primary Healthcare Development Agency, in collaboration with UNICEF and the World Health Organization, say all is set for the flag off of the phase 2 of the vaccination exercise for the human papilloma virus scheduled for May 2024 in Delta State. The Executive Director of Delta State Primary Healthcare Development Agency, Dr Yinkore Paul, revealed this when he led a team of UNICEF, WHO, and senior management staff of the agency on an advocacy visit to the Delta State Orientation Bureau, where they were received by the CEO, Barrister Fred Latimore, in Asaba, the Delta State capital. According to Dr. Yinkore, the team is seeking the collaboration of all relevant stakeholders and government agencies to ensure that the second phase HPV vaccination exercise targeted at young females between 9 to 14 years is successful to prevent cervical cancer in the state. In his response, the CEO of Delta State Orientation Bureau, Barrister Fred Latimore, assured the visiting team of the state government support and that of the Bureau to sensitize Deltans in the urban and rural areas to be vaccinated. Barrister Latimore also highlighted the efforts of the Delta State government in providing healthcare insurance scheme for students in higher institutions and order by the governor of health professionals that have left the country for greener pastures abroad. Quest Charles Kosipi reports that Barrister Latimore also expressed optimism that the state governor, Right Honorable Sheriff Obolobori, would likely attend the flag-off exercise and appeal to residents to avail themselves of the vaccination opportunity.
Severally and again, we're hearing of emergence of new diseases. And then while we are tackling old diseases that are here to go away, what the world can offer us in some of these situations is to look at the situation. What can the health sector do globally to address issues? One of those is the administration of vaccines as an effective method of a public health method of preventing diseases. Currently, we have a lot of vaccine preventable diseases. We are here to also give information on yet another one that the world has been battling with. This time I want to talk about the human papilloma virus vaccine. You remember in the year 2000, the world had the pandemic, the COVID-19 pandemic. Not that the virus we just created, the virus has been there, it has never been as virulent as this. And when the virus became virulent, it came with a lot of complications and also people dying. And all of us went through that lockdown. Unless we are guiding our oasis very well, we may be greeted by another pandemic. Now for the human papilloma virus vaccine, it is one of the surest approaches of curbing the possibility and likelihood of a girl or the female child coming down with cervical cancer in the course of her reproductive life. And we know, even as it is now, there is no definitive cure for cancer. Many of the people who come down with cancer, they die. Unless it is discovered in the early stage, when it is just coming up, then we might be able to do one or two things. And this vaccine is going to help us protect our children. For now, the government has made provision to take care of young girls from 9 years of age to 14 years of age. So the question is, what about our mothers like this? What about the older people who started having children? The thing there is that we believe that for the older people, many of them might have suffered from the viral infection before they recovered, they're not having problem. But in case they come down with anything like cancer, it means we are discovered at a late stage in life. But we might still be able to do something if it is discovered on time. The early stage of the cancer can be curbed. But with this vaccine, we are looking at indigent ones, people who cannot afford to pay. Currently, the globe is on the drive of attaining what we call universal health coverage. We used to hear of health for all. Also, And the Delta State government is also, as part of our more agenda, tells us about meaningful development, opportunities for all, realistic reforms, and also enhance peace and security. This also covers our health sector, and that is why we are here to intimate you. And what to expect is that there is no fear, no doubt about the vaccine and the safety of the vaccine. It is safe, and it's also going to be administered free of charge. Government has paid for it. Partners have also given a lot to it. I want to make it, Nigeria system is that we want to make it a routine vaccine. But for a start, we will carry out maybe a flag-off vaccine. Is called human papilloma virus vaccine. We are going to give it, not that we don't want to administer to older people, but for those who cannot afford, who are vulnerable. So we are looking at young girls from the age of 9 years to about 14 years of age. Another thing is that the vaccine is going to become a routine vaccine, domicile. So like I want to create the indulgence of the CEO. When that time comes, we'll be having reason to communicate with you again and again.
And they say health is wealth. And the more agenda, as rightly said, is it's about realistic reforms. And the health sector also, I'm sure that this administration is determined to also look at our health policies and see whether we can also bring some reforms and innovations on how some of these the health services that you render can be improved upon. I hope that your agency will try as much as possible to also back up your sensitization efforts with local advocacy in our rural communities, and that is the area I think that the Orientation Bureau will have to come in to assist you to a very large extent, because we need to drive this information to our people, especially the uneducated ones, and those who are schooling in the river areas too, the teachers there, and those who are also in the community health centers. They will also need to be carried along so that this vaccine can go round and achieve the aim of government. Because cancer is cervical cancer is not something you play with. It's a very serious ailment, and this vaccine, if it's administered early enough, will not take care of that problem. And we are going to work with you extensively to make sure that we get this information across to our people, to make our children and girls available for this exercise. At our own end, we'll try and reach out to His Excellency and the SSG with a proposal on how we can assist your agency to orientate our people, to get this information across to our people in the 3 senatorial districts. May, you said, is the flag off. We're in March, so we'll try to start to work now and see how we can get things in place before the takeoff time, so that we can send out some radio jingles, and then also carry out some sensitization programs, informing the people that this flag off will be in May, so that we can effectively work with you. The governor is very much interested in improvement of health services, and if you recall, recently he has also approved the recruitment of medical personnel that left the state as a result of these greener pastures overseas, and the governor has said we must replace them. We must get enough doctors to look after our people. And for our students in institutes of higher learning, the governor has also approved the takeoff of the tertiary institutions health program for undergraduates across the country, so that when you are a student of Delta State and you are in any institutions across the state, across Nigeria, you should be able to access our health, services that we offer through the state health insurance scheme. And I think Dr. Isaac Akpomita is doing well and is also partnering with us to drive this message to our people to make sure that they make themselves available for these services. Government is investing so much in it, but what we need to do is to let our people know that they need to come and benefit, from these services that government is rendering.